Hello, my name is Anelli Melgoza, and this is my community project in the class NSG 323, Community and Public Nursing. What is a community? A community is a unified body of individuals, such as people with common interests living in a particular area. All communities are different and have diverse people with different cultures and backgrounds. Some communities are small, others are larger. Communities are important because they offer individuals resources that help meet the needs within a community. The community I chose to assess is the city of McHenry in Illinois. McHenry is a suburban-like city that gives the impression of a close-knit community feel. I completed a windshield survey in the city of McHenry by driving around and noting any observation and community characteristics. I noticed that the boundaries in the city were not clearly defined. What made it obvious where the community started and ended are the welcome signs. I took into account that the community made me feel that it was safe. There was a strong law enforcement presence. The city appeared to be clean and there was minimal litter. The air quality was good and there was no presence of homelessness when the survey was conducted. There are many services in the community, such as grocery stores, restaurants, fast food places, gas station, retail stores, many places of worship, and various daycare centers. Many of the stores and businesses were found along Richmond Road. There are various schools in the city. They all appeared older in age, but were well maintained. There are many city parks and a state park in the city. McHenry is known for the River Walk, and McHenry is home to Fox River. There's a strong medical presence in the city. Many doctor, dental, and chiropractic offices are located in McHenry. I also took note that there was skilled nursing facilities and assisted living communities in McHenry. There's a main hospital in the city, Northwestern McHenry Hospital. McHenry is home to the only VA community-based outpatient clinic in the county. Through research and completion of the windshield survey, I discovered that the population in McHenry is 27,135 residents. The population density is estimated at 692.91 inhabitants per square mile. The median age of the residents is 37.1. There are many veterans that live in the city. It is estimated that 1,403 veterans live in McHenry. McHenry is home to many veterans who have served in the Vietnam, Korean, and Gulf Wars. Lack of diversity is prevalent in the city. The U.S. Census Bureau claims that 2% of the population is Asian, 0.7% is African American, 14.9% is Hispanic, and the majority is Caucasian at 94%. Mental illness in McHenry County has increased. According to the McHenry County Department of Health, 9 out of 10 suicide attempts reported in the year 2010 through 2014 accounted for the lives of residents aged 65 and under. Drug and alcohol are also a problem within McHenry. The McHenry County Department of Health states that the rate of alcohol and drug-related deaths in the past 15 years has increased. Drug and alcohol were found to be the most common hospitalization in McHenry County in the year 2017, according to McHenry County Department of Health. I was motivated to focus my project on mental health based on research and mental health statistics. For my community project, I chose to expand veteran mental health education for a group of home health nurses caring for a community of veteran clients in the city of McHenry. In this slide, I will discuss partnerships and resources that were formed to advance my project. In a partnership, partners work together sharing a common goal, whereas resources are assets that help achieve a goal. Partnerships were formed with a clinical nurse manager at Accurate Home Health and a VA social worker. I will begin by talking about Jennifer, who is my liaison. She is the clinical nurse manager at Accurate Home Health. Jennifer allowed me to implement my presentation to a group of home health nurses. Jennifer also helped guide my ideas for my community project. Julie, the VA social worker, provided feedback on my project and provided information specific to the mental health of veterans. Her expertise was significant to my project. Resources that were used for the community project include Accurate Home Health. Accurate Home Health permitted me to expand veteran mental health education by allowing me to present to a group of home health nurses and allowing me to give them brochures and pocket cards. Lastly, the VA community-based outpatient clinic in McHenry supported my project by allowing me to obtain information about services available to veterans. The community health diagnosis that was determined for this project is risk for suicide among veteran home health clients in McHenry County related to depressive symptoms and substance misuse as evidenced by increased rates of suicide and a rise in drug alcohol related deaths in the community. Interventions are needed to meet the objective. A community health plan was created for the community project. I created a PowerPoint presentation that was presented in person to a group of home health nurses. The goal of the PowerPoint presentation was to bring awareness of mental health illness and resources for veterans in McHenry County. The presentation incorporated statistics on mental health in McHenry County and community resources. I also created a pamphlet that supported the PowerPoint presentation and included informative community mental health resources specific to veterans. I also created pocket cards. The pocket cards contained important mental health information within the community that was made for the home health nurse and veteran clients. The interventions developed for this project include a presentation, pamphlets, and pocket cards. Interventions are required to meet the goal. Goal number 1, the home health nurses will be able to verbalize 4 mental health resources available to veterans in the county by the end of the educational presentation. This is a short-term goal. Goal number 2, upon completion of the presentation, the home health nurses will be able to identify 3 risk factors in McHenry County that contribute to suicide among veteran population. This is a short-term goal. Goal number 3, in the next 5 years, McHenry County will experience decreased numbers of suicide among the veteran population. This is the long-term goal. This slide shows the PowerPoint presentation that was presented to a group of home health nurses at Accurate Care Home Health on April 8th. In this slide, I demonstrate the pamphlet that was given to the home health nurses. In the image to the left, note that I included mental health resources in McHenry County. Each resource listed has a phone number and a description of what they offer. On the right side, I included statistical information about mental health and veterans, and I also included veteran mental health resources specific to the county and with the VA. This slide shows the pocket card that I created for the home health nurse and veteran clients in McHenry County. The pocket card is the size of a business card. After I completed the presentation, I received feedback from the nurses that they really liked the Pocket Card because it was small in size and they thought it would be useful for them and the veteran client to reference to if they ever needed to refer to any mental health resources within McHenry County. The success of the goals was determined at the end of the presentation. Goal number 1 was met. The home health nurses that attended the presentation were able to verbalize at least 4 mental health resources available in McHenry County. Goal number 2. This goal was met. The nurses were able to identify 3 risk factors in McHenry County that directly impact suicide rates among veterans in McHenry County. Goal number 3. This goal was not met. The goal was not met because it will need to be continually assessed, since the goal intends to decrease suicide rates among veterans over the next 5 years. Through the community assessment, I learned that the City of McHenry is unique and offers its residents many opportunities. The windshield survey uncovered important characteristics that make up the community, but also revealed its weaknesses. These weaknesses include lack of diversity and mental health illness. The objective of this project was to expand veteran mental health education to a group of home health nurses caring for clients in McHenry. I began by gathering data and evaluating the community need. Partnerships and resources were then established. A community diagnosis was created. Goals were formed. Interventions were implemented. And finally, goals were evaluated. This community project has been a significant accomplishment of mine, and I truly think that this project has the potential in increasing mental health awareness among veterans in McHenry County and decreasing the suicide rate within the next 5 years. In this slide, I list all the references that were used for this PowerPoint presentation.